the biggest challenges of the 21st century is curing cancer. But before scientists and doctors can actually tackle that problem, they need to be able to detect cancers. Current techniques are often invasive, have high initial costs, and lack sensitivity and specificity. And that's why we're coming up with a novel solution called Cancer Detect. Our idea, Cancer Detect, is split into two separate components, a hardware component and a software component. So the hardware component is actually developing a fully functional assay that can detect hypermethylation markers within a coding region of a gene. So without going into too many of the specifics of the biology behind it, scientists are now believing that based on current trends in research, hypermethylation markers, or the presence of CpG dinucleotides in specific regions of tumor suppressor genes, might be a more effective way of determining if an individual has cancer or not. And we're using an assay or some sort of detection method that can quantify the presence of hypermethylation within an individual kit, and then use a subsequent algorithm that can tell us which specific histological subtype of cancer it is, i.e., whether an individual has pancreatic cancer, breast cancer, or lung cancer. In addition, our product is not the first one to necessarily make use of the hypermethylation marker. Currently, there are two other products on the market. There's Cologuard and the Oncomine liquid biopsy assay. With regards to Cologuard, Cologuard is a recently FDA-approved colon cancer screening technology. However, its utility beyond the scope of colon cancer is extremely limited, and we believe that our assay and the algorithm expand the range of what our product can do. In addition, the Oncomine liquid biopsy assay is extremely expensive, and we believe that using a primer hybridization technique will actually reduce initial costs and reduce sequencing time, giving faster turnovers and making it easier for a patient to find out if they have cancer or not within a reasonable amount of time. Up to this point, we have been hosted by Dr. Kang Zhang of the Shiley Eye Institute and the Biomedical Research Facility at UC San Diego. We've developed a complete framework for the machine learning algorithm that we're going to be using. We've also performed a feasibility analysis of the wet lab portion, and we've also begun to deter specific parts of our business model. We believe that working in conjunction with the Basement and the Summer Innovation Incubator, we hopefully can develop a fully functional web tool by the end that embeds the algorithm and makes it easy to use for everyone. However, we do believe that the functional assay that we're developing itself should only be targeted to oncologists at this point in time and professional healthcare individuals. In addition, we believe that the mentorship from the incubator allows us to fully flesh out our ideas of the business model and make sure that it's a viable option going forward. And finally, we want to start building a minimum viable product, or an MVP, as a functional prototype that we can then present to potential investors. We believe that Cancer Detect can truly revolutionize the world. Currently, cancer detection techniques are one of the main reasons that scientists have begun to struggle within cancer detection, and we believe that having a low-cost, affordable structure such as this will actually help save numerous lives in areas with reduced healthcare. Thank you very much.